afternoon, and welcome to the update on COVID-19 in the Bahamas. I wish to report to you the latest figures. The total number of confirmed cases of COVID-19 is 97. Of that number, 75 are in New Providence, 8 in Grand Bahama, 13 in Bimini, 1 in Cat Key. I'm pleased to report to you that there were no new cases reported today. The number of recovered cases is 44. Active cases are at 42. Deaths remain at 11. And hospitalized cases, there's 6. A total of 1,910 tests have been completed. In Grand Bahama, there have been 15 days since the last confirmed case of COVID-19 was recorded on that island. And in Bimini, it has been 7 days since the last confirmed case. In the Bahamas, the highest number of cases, if you look at the slide, is occurring in the 40 to 59 age group and not in the 80 and over population. This national profile is different than the global presentation, which show that the greatest number of COVID-19 cases are in the elderly. I'd like to take this moment to commend the nursing home operators who are enforcing the COVID-19 containment and mitigation policies set out by the Ministry of Health, which include visitor restrictions, infection prevention and control measures, training of their workers in infection control, environmental sanitation, a moratorium on readmissions, and government measures to protect the elderly population, including weekend lockdowns. We're making significant progress based on a number of new confirmed cases. There have been no confirmed COVID-19 related deaths for 3 weeks. And the number of, we measure this based on the number of deaths, the number of recovered cases, the decrease in COVID hospital admissions, and the decrease in the number of ICU admissions. During this epidemiological period of week 20 to 21, we have had 1 to 2, as you see in the slide, 1 to 2 confirmed cases per day, compared to 5 to 6 confirmed cases recorded previously, which has resulted in a new epidemiological plot and projection. And you would see this through the slides, and the absent or the blank periods are due to no cases. As you see in the projection I previously showed you, this is the path for this is the projection for New Providence. Next slide, please. And this is for all Bahamas. And what we are seeing, if you can go back a bit, with the no new cases and the frequency of 2 cases, these projections would go in a downward trend, and i.e. bending the curve. But we will await a week's time and another week's result to present to you a new model. Bimini, please. After being identified as a hotspot and subsequently receiving reports of 2 new cases from the island of Bimini, the Prime Minister announced last week that a lockdown of Bimini would commence on Monday the 18th of May at 9 p.m., until Saturday, the 30th of May at midnight. This lockdown was implemented to assist in further containment and control measures to mitigate the community spread of COVID-19 in Bimini. Now, via the communications unit of the Ministry of Health, we provided education material, public service announcement via WhatsApp to Bimini residents, and kept them aware of current information via our press conferences. Residents of Bimini will be given an opportunity to voice their concerns at a virtual town hall tonight at 7 o'clock, and again on the 28th of May. Local government officials have confirmed that the community has sufficient food and supplies for the lockdown period. Report is that residents are sheltering in place, and further, in association with Dr. Pamela Ellis Mills and a team from New Providence, their psychological needs are being supported. Presently, the mood in Bimini is calm, and based on reports, residents appear to be adhering to the preventative measures established by the Ministry of Health. Residents of Bimini are taking advantage of virtual technology to stay connected. This week, they were engaged in a number of activities via Zoom, including spiritual devotions, workouts, and skill-building exercises. We continue to carry out contact tracing and to monitor residents who are recovering from COVID-19. The Prime Minister, in his national address last Sunday, announced the commencement of commercial activity in a number of family islands and the gradual reopening of inter-island travel. Slide 10, please, which is color-coded and shows that the islands cleared for commercial activity and travel to New Providence and Grand Bahama are Cat Island, Long Island, Abaco, Andros, Meguana, Inagua, Crooked Islands, Acklins, Long Key, Rum Key, and Ragged Island. It has come to the attention of the Ministry of Health through the newspapers and social media that a number of Bahamians living on the islands of Eleuthera, Exuma, the Berry Islands, and San Salvador are concerned that they were not cleared for inter-island travel or commercial activity, though they have had no confirmed cases of COVID-19. The government has taken a phased approach to reopening of the family islands. The Ministry of Health continues to monitor the effectiveness of the public health measures to prevent and control the spread of COVID-19 on the islands that remain closed. The ministry will continue to participate in interministerial risk assessments to determine the eligibility of the remaining COVID-19 free islands to return to commercial activity and inter-island travel. We would like to detail the process to acquire approval for travel by the Ministry of Health. For people requesting inter-island travel who wish to travel to or from New Providence or Grand Bahama by plane or boat, the process is as follows. 4 steps. Step 1, download the Ministry of Health application to travel and the consent form. These exist on the Ministry of Health website, bahamas.gov.bs.health, or covid19.gov.bs. You're then required to submit the completed forms to COVID-19 travel at bahamas.gov.bs. Copies may be collected from the Ministry of Health main security booth or any public health clinic and returned to the Ministry of Health. Step 2. Select an approved physician for completion of a risk and physical assessment. Step 3. Assist the healthcare team to complete a home quarantine assessment. And step 4, await further instructions via email or phone once your application is completed and approved. The application process will take up to 5 working days. Applications submitted via hard copy to the Ministry of Health may take a few days longer. We wish to advise that persons should not make travel arrangements until they have received an official authorized document from the Ministry of Health. Non-approved applicants will also be notified. The public is also reminded to direct all travel-related questions and concerns to COVID-19 travel at bahamas.gov.bs by email. The Ministry of Health is preparing an alternative. They would provide a phone number. A phone number will be established in short order to address further queries. Special requests will be reviewed on a case-by-case basis. The Ministry of Health thanks the members of the public for their patience and cooperation as we continue to refine our travel processes. You would be aware that today the government began the second repatriation exercise of Bahamians and residents from Florida. A total of 210 residents are expected to be transported from Fort Lauderdale to New Providence. 96 were scheduled to have landed in New Providence. They're still awaiting the flight. A second flight is expected to arrive on Saturday, the 23rd of May. Upon arrival, residents will clear their luggage and be transported immediately to the government quarantine facility. We would have received laboratory forms from many of these residents who took a COVID-19 test. A physician review panel has been established to ensure that all outside laboratories used for tests are accredited. There are teams on the ground, and our teams have worked very hard to advise residents of the quarantine rules and to pre-approve as many people as possible. For those desirous of home quarantine, their residences are assessed to ensure that they're able to self-isolate should they be required to do so. Those residents whose homes do not provide for self-isolation will not be recommended for home quarantine. The National Emergency Management Agency has organized the cleaning and preparation of vacant rooms at the government facility to be ready to welcome our residents home. Should there be an oversubscription of the quarantine sites, the Ministry of Health has identified an additional location. The public health measures set in place are to slow the pandemic in the Bahamas. They're working. For them to keep working, you must keep the following guidance. The pandemic is not over. I repeat, the pandemic is not over. More than 330,000 people have died around the world from COVID-19. I ask you to stay disciplined, stay physically distant as much as possible, and continue to protect your elders. In doing so, we can further progress through the opening up phases and return to a greater sense of normalcy. Thank you and good afternoon. I would like very much to ask Dr. Frank Bartlett from Grand Bahama to give you a brief report of what is going on in Grand Bahama. Dr. Frank Bartlett.
Good afternoon. Dr. Dowell Regis would have already given you our figures. Our last patient would have tested COVID positive. That would have been on April 30th. She remains asymptomatic and recovered. Our major exercise for this week will be the repatriation of passengers coming in from the Florida area. We are anticipating that we would have some 59 persons coming in. We would have begun our evaluation of those persons via telephone yesterday to have an idea of those who would need to be quarantined at the government facility or home quarantine. Our procedure is similar to what they have in Nassau. We have a two-part evaluation process. Our preliminary evaluation is done at the airport where the passengers are disembarked, maintaining social distancing. They are evaluated first by the health services where preliminary information is taken already pre-recorded on the form that they would have filled out in flight. Their temperatures are taken and they are asked about symptomatology. They are next taken to the immigration station, and after that they are mounted on a bus that would have had pre-arranged seating. We have a secondary evaluation station at a hotel that is secured. We ask all family members who are involved with picking those passengers up to wait at a designated area. At the secondary site, their evaluation includes a more extensive probing as to what they would have been doing, the contact history, any type of health issues they would have. We ask a little bit more about the home environment to ensure those persons we have identified for home quarantine meet the requirements if they had not at the point of time had a home evaluation done. Once it has been decided that that person meets the quarantine for home, they are given a specific card that states they are cleared for home. They give that card to the security officer. The security officer then calls to the secure gate and they have their persons allowed to come in. So the process is monitoring straight from the minute they get off the plane to them leaving the secondary site. Those who have been identified for quarantine at the government site are the ones who are taken directly there by the Grand Bahama Health Services. The persons who would have arrived at March 8th and who have been in government quarantine, they will actually be discharged tomorrow, probably before noon. The evaluation by the Grand Bahama Health Services will begin at 10 o'clock. To date, we have had no major issues. We have been keeping in contact and monitoring the activity and the health status of the persons who have been in quarantine, and we have had no type of reports of any type of illnesses or any other challenges with the persons both in home quarantine and those patients at the government facilities. Thank you.
Okay. Thank you very much, Dr. Bartlett. We'll now open the floor. We'll now invite questions, please, and we'll begin with Jerome Sawyer.
Good afternoon, Dr. Dowell Regis. If you can please clarify for us, you said that the government has taken a phased approach to reopening the islands, family islands. If you can please explain to us what is the criteria that would qualify an island to be opened versus one that remains under the restrictions?
Thank you very much. We have been monitoring the implementation of the public health measures on those islands, number one. We are looking at the interministerial surveillance of those islands to look at the traffic flows to the island. And we're getting particular guidance on that matter. So the criteria are, the three, well, there are two criterions, the two criteria that you have given you. The third is the response of the local team. Many on the local team are asking us to phase in because of the traffic that is occurring on island, particularly from pleasure vessels. So we use that guidance, and we are planning that if these measures remain or impact the no new cases for a further period of time, that we would certainly recommend that they be considered for reopening of commercial activity.
Without sort of losing my opportunity for a second question, I wanted to know whether you'd be in a position to say which of those criteria may have applied to the islands that were not taken off of the restricted list.
Each of those islands, particularly those that receive international direct flights.
Okay, that does help to bring some clarity, I guess. The other question has to do with the approval for inter-island travel. I know from just personal experience that there was some ambiguity as to what the process would be in obtaining those travel approvals. But from the public's standpoint, are you able to say to us, how do we know, or how are we able to find out who are the approved physicians who would be able to give us who would be able to assist with the travel criteria? And how do you access that list? Where can we find it? And should you not be able to access any of those approved physicians, is there a list of public physicians, or is there a public facility that people can access directly should they not have the benefit of a private physician or one of the physicians listed?
Thank you. There will be a published list on the government website. There would be the physicians who have applied to do this work with the COVID-19 assessment, risk assessment, and physical assessment. That list is growing. We're very pleased to say that there will be at least 20 physicians on that list. We intend to open up the 3 polyclinics, but at this time, the South Beach Clinic has already begun doing the assessments for inter-island travel. I think that's your 2 questions. Altanice Munnings. I can't hear you.
Can you give us an update on how many individuals have registered for the Inter-Island program? I know the Prime Minister said in his national address on Sunday that the registration process began yesterday, Wednesday, May 20th.
Okay. We've had queries and applications. We had over 900 queries for applications on the first day. But I have Dr. Bartlett, who's here, who's monitoring the situation, and she will give you an update.
Good afternoon. So as Dr. Dalridges would have said, as of yesterday, we would have had over 900, and today we are well over 1,000 in queries. That's persons seeking questions on travel. We'll have to go through the queries to see how much of them are actually applied for inter-island. But as of to date, it's growing. At South Beach Clinic yesterday, there were about 17 persons cleared and screened from the disaster authority that needed to get into Abaco this morning for travel, so they were screened at South Beach and processed and allowed to travel this morning.
Update on those passengers who are on the initial repatriation flight who are in quarantine. Are a lot of them still in home isolation, or are they still at a government quarantine facility?
We have approximately 40 plus in government quarantine, and 62, there was between 62 and 41 split between government quarantine and home isolation. And you wanted to know if they were doing well? Sorry, was there a part of the question concerning the welfare of those who are in quarantine? Because we've had a number of repatriated residents who've had medical challenges, and one in particular had to be hospitalized. But for the most part, I can check with Dr. Forbes, who's here. You can give us an update on the health status of those. And you're fully aware that we had nursing coverage at 24/7 nursing care coverage at the government facility. Dr. Forbes.
Thank you. Good afternoon. Patients that are both at our government quarantine facility associated with repatriation exercises, as well as others who are in the national isolation and quarantine facilities, are monitored by our team, including nurses and members of the health team. If problems arise, they receive medical attention, and a few of them have been assessed at the Princess Margaret Hospital. I can report that one of the Bahamians that was repatriated in the last exercise did start to have complaints that were related to fever. However, he was fully assessed and his medical problem was not COVID-related, and we have indeed dealt with his problem in the appropriate manner. We have had no adverse outcomes with any persons in any of the facilities to date.
Thank you, Dr. Forbes. Tyler Simonet, please.
Yes, good afternoon to everybody. For my first question, yesterday the U.S. Embassy pledged $750,000 in health assistance to the Bahamas in the fight against COVID. Now, could you please inform us as to what form this donation is in, for example, tests, hazmat suits, etc.? And if the donation is in the form of cash, what areas will you focus on funding?
I regret to tell you I do not have that information.
Okay, that's fine then. I suppose I'll move on to my second question. And the Secretary of State Health for the United Kingdom, Matt Hancock, announced today that the coronavirus, a coronavirus test that will give results in 20 minutes is now being trialed. Are you aware of this recent update, and what could this mean for the future of testing?
Can I invite Dr. Forbes? Would you care to do?
Thank you very much. So a fast, accurate coronavirus test is something that the world needs. The Bahamas also needs that. When we think about testing, we have to go back to how good is the test? Does the test detect disease when it's there? And does it correctly identify when disease is not there? There are tests such as the PCR test. There are some platforms where test results can be available within an hour. We are looking into that. On the other hand, there are other faster tests that are serological tests, and up to this week, there was a caution that one very well-known brand was not performing as well as we thought it would. However, you're absolutely correct. The key to moving forward in this new COVID-19 world is having a test that can identify disease accurately and quickly. We want to get there.
Rachel Knowles, please.
Good afternoon, Dr. Dal-Regis. I just first of all wanted to ask for some clarity. I know that you said that one of the factors that played into why some of the family islands weren't open is because they have international airports. And I just wanted to get a better understanding of why that was a factor, given that there aren't international flights right now.
The response to the question, what was some of the criteria considered when not reopening? And when I responded, interministerial surveillance, part of the consideration was direct international flights into those islands. Example, Club Med in San Salvador receives international flights from France and from Italy. We know that with surveillance activities, we want not to open up those islands to commercial activity, because that would certainly be a challenge to monitoring the activities there.
Okay, and on another note, speaking about international travel, I know that during his last national address, the Prime Minister said that they're looking at a July 1st date for resuming commercial flights. He didn't specify if it was domestic or international, but a lot of people have interpreted that to mean international. Now, in the phased reopening that they would have sent out a few weeks ago, that's not supposed to be until phase 5, and we're still in phase 1B, and July 1st is roughly 5 weeks away. Is it the plan of health officials that will go through 4 phases in roughly a 5-week period? And if so, is that a realistic timeline?
That sounds like an optimistic question, isn't it? Only the Prime Minister will be able to answer that. But I say to you that given the trajectory we're having now, given the number of new cases, or the low number of new cases, the decrease in COVID hospitalizations, the decrease in the number of ICU beds, the system is performing well. And we would certainly share that information with the Prime Minister to guide his timetable for reopening of the country. Oh, Rachel, there's 5. No, Matthew Moxie, please.
Yes, good afternoon. We note that health officials have said that they are monitoring the prison as well as nursing homes, but today we got some calls from workers at Sandilands who are alleging that the latest COVID-19 patient is a patient of Sandilands, and they are raising some concerns that safety protocols are not being followed in this particular facility. Has health officials received these reports?
Health yesterday received the information concerning a new positive. That was yesterday, and this person was known to health in that he's a contact of a family member. Contact tracing was initially challenged, admittedly, because he went back to work and then disappeared. And surveillance was assisted by the Royal Bahamas Defense Force, the Royal Police, and the Emergency Medical Services. And I'm pleased to report to you that he is in a mandated government quarantine facility. We will continue our contact tracing at his place of work, and it is going to be challenging, but we're up to it, and we will report back with the success of the contact tracing. There's no need for fear. The surveillance team is well positioned to manage this. And this is not the first case that we've had at that institution.
Okay, perfect. And then my second question is, there's also some concerns about the repatriation flights. Some people are saying that they are unable to get on the flight, but they would have already paid money for COVID-19 tests, which they say are very costly. So they go and get these costly tests, and then they are not sure if they can actually get on the flight. And then, they get the information that they can't get on the flight. And, the test results have, I think, a 10-day span, or I'm not too sure about the span the tests have. But then they have to constantly do these steps over and over in hopes of getting on a flight. Is it the mandate of the health task force to now maybe suggest that there should be a repatriation flight schedule so that persons can better plan for when they want to return home?
I think that's an excellent question, because it has been brought to our attention that the 10-day date of the tests prior to travel is a challenge when you don't know the repatriation dates or the flight dates. We are doing our best to work with the Ministry of Foreign Affairs to coordinate the services. We positioned a physician over at the destination where the flight is originated, just to review those COVID tests and to be sure of their validity. We thought that would be helpful. But you're absolutely right. We have to do a better job with timing and coordination. And health will do all it can to assist with the response for repatriation, recognizing that it's quite a financial burden on many of the families, particularly if it's more than one member of the family. Shamarko Lightburn, please.
Good afternoon, Dr. Dalregis.
Good afternoon to you.
So June 1st officially begins our hurricane season, and it is known that storms and hurricanes in their aftermath are known to increase certain diseases. For tropical climates, that's things like dysentery, cholera, dengue. Is our COVID-19 task force already proactively working towards any sort of overlap of the season and the state of COVID-19 now, or is there a specific new task force implemented that will assist with that?
We don't envision a new task force to take us through the end of the year, when we anticipate that there is going to be a new pattern of infectious diseases. And as we learn more about COVID-19, we certainly have to monitor the presentation of this new virus. We are closely following all the literature, and we are preparing as best we're able. And I think we're doing a fair job with putting in place the infrastructure to mitigate. You've heard of the infection control measures, the various orders, the requirement of training, the needed supplies. We're looking at burn rates for the equipment and the laboratory services. We're monitoring that on a daily basis, anticipating that we would have, hopefully, we will have some front loading of our supplies, so that as the summer approaches, or should these global supplies change, their access to the global supply changes, we would be able to continue the level of care, treatment, and support that we are currently practicing. Over.
Thank you. Mm-hmm. Thank you. And for my second question, once again regarding commercial activity on certain COVID-19 negative islands, such as Exuma, the Prime Minister did mention in an interview with ZNS that part of the phased approach also had to do with not burdening the healthcare system. For example, if an island like Exuma were to go viral. So in your estimation or the advice from the Ministry of Health, how much of it is to do with a more utilitarian approach, as in, the good for the country, that we need a slower phased approach, versus a really concrete medical rationale as to why one island can't be open?
Caution. We would not blow caution to the wind. We need to, when the Prime Minister refers to capacity, it's not only in New Providence, it's capacity on the island itself. And we are certainly doing the monitoring of using your local health teams. And if perchance there is a need to strengthen those teams, we will have to mobilize resources from New Providence to support the activities in Exuma and other islands. We do appeal to you, we share with you, that there are protocols in place for your visitors entering the island to make contact with the local health system. And we're really having challenges with compliance with that. And so we appeal to the practices that you have on some of these islands, where you have folks accessing the island and not being compliant with the measures, the public health measures that we have advocated. It seems as if, we have to strengthen or approach that so that we can have some assurance that the local community would not be impacted by importation of coronavirus 19. Thank you. Ava Turnquest, please.
Good afternoon, Dr. Dalregis. There have been, close to 2,000 tests completed now. Can you speak to the number of tests that we have in country, or what those resources are looking like? I note that we are, because it's impacting our ability to, really gauge where we are, because we're not doing widespread testing. And if we were, it could have possibly sped us up in terms of getting a better sense of how we're faring. What's the number of test kits that we have in hand, if you can confirm for us?
Sure, be more than happy. We have more than 3,000 now, but test kits is just a component of the PCR testing. You need the RNA extraction kits, that is to take the genetic material out. You need the preservatives, the ethanol, and the enzymes. So there are different components to the test. So although we have 3,000 tests on hand, we have fewer than 2,000 extraction kits, and we're trying to get more. We do have adequate supplies of the other components for the PCR testing. We will always plan to have a reserve for acutely ill, symptomatic, or suspect cases. So we must balance our outreach community testing, holding a reserve. So that is how we prioritize the community-based testing. And we must test all contacts as well. Mm-hmm.
And so if I could have a clarification on a question that was answered earlier, if it wouldn't begrudge me my
That's your second question.
No. Well, let me ask my second question first, and you can see if you change your mind. My second question would be, we heard that this latest case has been tracked down with the use of, with help from the armed forces. We had last heard that there were 15 people in quarantine that had gone missing. Have all those been located? And how many people are being monitored with the new app?
How many people are being with the new app?
Monitored, the app that's...
Okay, yeah, I got it. In terms of the numbers of persons whom we have not been able to contact, we have their names, but we don't have the contact numbers, the telephone numbers for them, and that has been the challenge, and it still hovers between 13 and 15. With regard to the Hubcat, we've completed the training in New Providence. We should have completed the training in Grand Bahama. Probably Dr. Bartlett can speak to that. And we hope to go live on Monday. Now your clarification.
Thank you so much. I think it's for Dr. Bartlett. Perhaps you can just confirm. He noted that the last case that was tested on April 30th is now asymptomatic and recovered. Does that mean there are no active cases in Grand Bahama at this time? Is that what we can conclude from that?
Grand Bahama, that's Dr. Bartlett, Frank Bartlett. So let us invite Frank Bartlett, please, to respond to the training for Hubcat and as well as the status of your cases, active cases in Grand Bahama.
Training for Hubcat is ongoing. We've had sessions today. We're looking to implement the program as early as Monday. So once we have it implemented, we will use that to assist us in the patients that are being quarantined. There are no active cases in Grand Bahama. As I would have mentioned, our last case would have tested positive on April 30th, and we are now 15 days post discharge from quarantine.
Richard Roll, please. He's not there. Oh. Richard,
can you hear me?
No, I'm sorry, I can't.
Okay. Yeah, I said, especially given the persistently low increase in cases and the lack of recent deaths, what at this moment is the recommendation of your team on moving to the second or third phase of reopening?
We have shared our recommendation with the Prime Minister, and it is anticipated that he would announce as early as tomorrow the changes or the accommodations or what would happen in terms of changes with the measures that are currently in place, the restrictive, didn't want to use restrictive, but the measures that are currently in place.
Okay. And just to piggyback off Ava's question a bit, I understand that the Cayman Islands sometime in the last month approved a request from our government for about 10,000 PCR test kits. Can you confirm that?
Yes, I can. And they offered these kits at a very steep price. And we were really challenged at that time with the lack of supplies. You've heard about the swabs, and you've heard about the kits. But what we needed when we appealed to, when we reached out to every island, every territory in this region, we needed RNA extraction kits, not PCR kits. Now, they have an abundance of PCR test kits. And at this time, we are looking at the costs that they're asking for them, and do we need them, and can we get them? We've gotten all our supplies previously from vendors through a strategic fund of PAHO, and that gives us very low prices. So given the difference in price of those Caymanese offer of test kits, not the RNA extraction kits. In fact, they were asking us to share our RNA extraction kits at the time when we were asking them for kits. But now we're in a better position. We are evaluating the costing, and how we would proceed to be sure that we have adequate supplies through this coming period. Is that your last question? Thank you so very much. Have a good afternoon.